This is Counterpoint, and I'm your host, Tanya Granick-Allen. Do you or anyone in your family take prescription medication? Do you pay out of pocket for your pills, or are your meds covered by your work insurance plan, or perhaps a government drug benefit program? Whatever case may be, things may be about to change very drastically for you and very soon. The government's latest budget federally sets aside $1.5 billion to implement Pharmacare, making good on a promise for the past number of years to do just that. Recall that Canada is the only country in the developed world with a universal health care program, but which does not cover universally for prescription drugs. But is this program a good idea? Will it help Canadians? How will the Pharmacare Act be implemented? Projections estimate that a national Pharmacare program would cost about $15 billion. Some critics argue that this is simply too rich for a country still battling high inflation and, of course, ever increasing taxes. Others suggest that national Pharmacare is really just part of comprehensive social health care programs. Well, joining me now to discuss this program and its potential effects in the country is Dr. Joel Lexchin, a retired emergency physician and associate professor at the University of Toronto. Dr. Lexchin, thanks for coming on again. I recall we had this conversation nearly 4 years ago, and it sounded like Pharmacare was just about to happen. Well, here we are 4 years later, and finally, the Pharmacare Act through Bill 64 has passed the House. Still has to go through the Senate, but things are progressing, shall we say.
Things are progressing, but unfortunately, very slowly. If anybody had paid attention or was paying attention back in 2018, there was the report by Eric Hoskins, who advocated for a national pharmacare program. The would have started initially in 2022, so that's 2 years ago, and then built up to become a fully functional first dollar coverage plan covering all Canadians by 2027. So we're not going to make that. But hopefully what is gone through the House and is now in the Senate will lay the framework for a national pharmacare plan. But exactly when is unclear. And whether or not it's going to be a plan that covers everybody publicly and people don't have to pay out of pocket, or whether or not it's going to be a fill in the gaps program. In other words, as you pointed out in your introduction, some people get coverage through private insurance, some people get coverage through public insurance, and unfortunately, about 25% of Canadians are either uninsured or underinsured. So a fill in the gaps would do that. It would help people who don't have insurance or whose insurance isn't comprehensive enough.
Now, you're a retired emergency physician. You have seen many things, I'm sure, in your long career. What are some of the problems or consequences of not having a pharmacare program when being a frontline healthcare deliverer?
Well, we know from surveys that about 25% of people either don't fill prescriptions, skip pills, or cut pills. And that shows up in the emergency department. It showed up pretty well every shift that I was working, when people would come in and they would be there because they couldn't afford their medications, so they got sicker with whatever condition they had, or they came in with a new condition. We saw them, we diagnosed them, we wrote a prescription, and then they said, well, I can't fill the prescription. What am I going to do? So we would call our social worker to see if they could get emergency coverage. Sometimes we would go into the stock of medications that we keep in the emergency department and give them enough to cover them. But it was always a struggle, and it meant that people potentially could get a lot more seriously ill if they didn't have their medications that they needed.
Yeah, and to me, it's always seems strange because, I mean, medical management and medication management is kind of an extension within healthcare. If you're going to publicly fund and have universal healthcare, then wouldn't universal pharmacare go hand in hand? So it seems strange that we don't have that. Although at the same token, this conversation has been going on for years, and It seems to be moving at a snail's pace, and one would think the government would be more interested in ramping this up. And things are coming along again slowly. We're going to unpack more of this issue when we return from this commercial break.